You know, the toughest question about the health spending conversation is how do you get costs down? Fundamentally, we spend way too much on healthcare. We've been saying that for approximately 40 years because it's been true for approximately 40 years.
Focusing on healthcare spending alone is not the right question, I think. We need to think about the value we're getting from the healthcare system. I'm a health economist, and people often ask me, what share of GDP should we be spending on healthcare? And the answer is, I have no idea, because there's no right answer to that. The answer is we should be spending as much money as we can to get high-value care that's worth it to us.
I think the toughest questions we really have to ask is, why is healthcare spending as high as it is? Is it an underlying issue of the prices? Is it overutilization? I think it's a combination of both. So how do we figure out what the drivers are before we can even begin to address what the solutions are?
We need to ask questions about healthcare like, is it necessary? Are we overtreating? Are we really doing the right thing? Very frequently in healthcare, I find that we're doing things that we think are effective, but we're actually ignoring the most effective things.
We need to be able to carefully decide what is high value and make sure that everyone gets high value care, and that which is not, we begin to learn to say, perhaps that's not right.
Two questions that I think are central. One is, what are we giving up when we spend more and more on healthcare? There's so many other national priorities. And then within healthcare, we know there's a lot of evidence of care that is low value or care that is no value, real inefficiencies. But how can we better find that care, and how can we get rid of it in ways that keep the American public's trust in their health professionals, and in ways that don't compromise the quality of care that people are getting?